Hi everybody, welcome back to the channel. Today we're diving into a topic that a lot of nurses are talking about right now, or even if you're not talking about it, you're thinking about it. And that is, are advanced nursing degrees still worth it? Whether you're considering becoming a nurse practitioner, a CRNA, or a clinical nurse specialist, it's important to weigh the pros and the cons of pursuing an advanced degree. So let's break it down. First, we're going to talk about the pros of the advanced nursing degrees. Let's start with the positives. There are definitely some big advantages to pursuing an advanced practice nursing degree, but you have to weigh which is good for you. The first pro is increased earning potential. You can make a lot of money working as an advanced practice nurse. And that's one of the most obvious benefits is the salary increase. Advanced practice registered nurses tend to earn significantly more than registered nurses. For example, nurse practitioners can earn upwards of $120,000 a year, and CRNAs can make even more, sometimes crossing the 200,000 mark. This higher earning potential can be life-changing, especially if you're looking to pay off some debts, save on a house, invest in your future. This can be life-changing money. Another thing for sure is greater autonomy. As an APRN, you have more autonomy in your practice. In many states, you can even practice independently. Nurse practitioners have full practice authority, meaning that they can diagnose, they can treat, they can prescribe medications independently without, having a physician oversight. And if you're someone who enjoys making clinical decisions, managing patient care, and being very independent on a deeper level, this autonomy is a big win for you, and this is something that you can definitely look into. Another thing is specialization and expertise. Advanced nursing degrees allows you to specialize in areas that are very passionate or areas that you are passionate about, whether it's family practice, whether it's pediatrics, whether it's mental health or anesthesia. You can focus on a niche area of healthcare, and this can make you a more valuable asset in your field. And it also allows you to have more profound impact on your patients. Another thing is job security and the demand. The demand for APRNs is growing significantly with physician shortage and a greater emphasis on preventative care. APRNs are stepping up to fill up those gaps. So if job security is important to you, APRN roles, especially in underserved areas, are likely to remain in high demand. The fifth one is leadership opportunities. Having an advanced degree opens doors to leadership positions in healthcare. That's a given. You can move into roles like the director of nursing, you can be like the healthcare administrator, you can even explore roles in academia where you can teach the next generation of nurses. If you're a nurse, these roles allow for a career growth beyond the bedside, and you can be a natural progression if you're looking for more influence in the profession of nursing. So now let's talk about the cons of an advanced nursing degree. It's not all rosy. It's not all sunshines and rainbows over here. It's really not. I recently saw a TikTok video and I'm gonna insert it right here.
The job market is horrible. So it's like I fought so hard to get this degree, to be a nurse, and there's no jobs. And I'm in so much debt from student loans. Like I spent all this money, or I took all these loans out to get this degree thinking that, I would be able to pay, with my career. And guess what? There ain't no jobs. The jobs that's out there for nurse midwives, no new grads.
The cost and the student debt of getting this advanced nursing degrees. The biggest drawback for many people is the cost of education, especially for me. Advanced nursing degrees can be incredibly expensive, especially if you're attending like a private institution. And, some programs can cost upward of hundreds of thousands of dollars. And if you're not careful, you can end up with crippling student loan debt. When you factor in the time that it takes for you to pay that off, you have to ask yourself if the return on the investment is really worth it. Another thing that's a big con is the time commitment that it takes for an advanced nursing degree. Getting an advanced degree requires significant time. The commitment that it takes, a lot of APRN programs take 2 to 4 years to even complete. Whoa. Depending on whether you're going full-time or you're going part-time, this can take a very long time. For working nurses, balancing school, work, a personal life, family, it can be extremely challenging and it can lead to burnout even before you finish the program. So that's something that you might want to consider, but there's ways around it. You can always find ways around it if this is something that you really want to do. Another thing that's a big con is the saturation of advanced nursing degrees. Depending on your location, the specialty, the job market for like advanced practice nurses can be very saturated. For example, in urban areas, there's a lot of nurse practitioners competing for the same positions. For example, in the DC area, every single nurse is a nurse practitioner. This can make it really hard for you to find a job, and salaries might not be as high as you expect, especially when the supply exceeds the demand. That's literally DC nursing. If you're a nurse in DC, shout out to you. Burnout and the scope of practice limitations is another con of advanced nursing degrees. Although APRNs have more autonomy, the responsibilities can also be very overwhelming because you're diagnosing, you're treating, you're prescribing, but in some states, there's restrictive practice laws. You may still need a physician oversight. This can be a little bit frustrating and it can limit your ability to practice to the full extent of your training. And with increasing patient loads and administrative duties, the burnout is a very real concern for APRNs. Another con is the uncertainty in healthcare policy. Everything is about politics and policy and politics and policy, and healthcare policies are constantly changing. The reimbursement rates for APRNs, the full practice authority, and the evolving role of healthcare professionals can shift depending on the laws and the regulations. So depending on who's in power or who does what, if you invest in an advanced degree, you're also somewhat at the mercy of the healthcare systems and the political landscapes that could change and affect your scope of practice or even your earning potential, your salary. And that is something you do not want anybody to play with. So, should you pursue an APRN degree? Is an advanced degree still worth it in 2024? It really depends on your career goals, your financial situation, your personal interest. Like, for example, if you're passionate about patient care and you really, really want to specialize or increase your earning potential, an APRN degree could be the right path for you. But if you're concerned about the student debt, the job market saturation, or the time commitment, that it might be worth exploring other career advancement options. There's a lot of things you can do in nursing. You don't even need to get an advanced nursing degree, like a leadership role, like even entrepreneurship. Use your skills, use your nursing skills, start up a business. At the end of the day, it's a personal decision, and you have to weigh the pros and the cons based on your unique circumstance. So yeah, would you be pursuing advanced nursing degree? And if you're an advanced nurse, please leave a comment below. Is it worth it? Would you recommend? If you have any questions or if you've gone through this journey yourself, drop a comment below and let's talk about it. And don't forget to like, subscribe, and hit the notification bell, for more content about nursing, finance, and everything in between. Until next time, my name is Maria Onadeko, and I'll see you in the next video.